Hello everybody, I am Dr. Sunil Dachepalli. I am a senior orthopedic, joint replacement and sports medicine consultant. I wanted to discuss a nice topic with you. This is treatment of arthritis without surgery. Now, lots of us are worried to have surgery, and your worries are also valid because any surgery can have their own complications like infection, bleeding, or having nerve or vessel damage, these sort of things. So, as much as possible, as a patient or as a doctor ourselves, we don't want to suggest unnecessary surgeries. Now, when it comes to arthritis, we have seen lots of evolvement in the arthritis treatment. So, can we avoid these type of surgeries? That's the most important thing. Now, when you take arthritis, it is two types: rheumatoid and osteoarthritis. Rheumatoid comes early in the life and it stays on all through your life. So you have to take medicine almost all through your life, and most important thing is you don't have to be worried. Now, our main concern would be the well-being of kidneys and liver. So every 2 or 3 months you should consult your doctor with some blood tests so that the kidneys and livers are being monitored. If you don't take this medication for rheumatoid arthritis for life, there is a high chance that you will start wearing out the joints, and you will wear out almost most of the major joints. Then you will have to have not only the tablets, also you should have surgeries. So be wise and take treatment regularly. The next thing is osteoarthritis. This is mainly a degenerative, that is wear and tear. When two smooth surfaces move, they cause friction and there is a wear and tear. That is why you don't see this arthritis in children, because the joint is really smooth and it's just very early in life. As you proceed in age, your joints become more stiffer, the knees become more drier, and then there is more friction causing wear and tear and then arthritis. So how can we prevent this arthritis, or how can we treat without surgery? First and foremost is early diagnosis. Now, there is always a denial mode for everybody saying, I'm absolutely fine and I won't get this arthritis. None of the human beings are immune to arthritis, especially when you are on your feet all the day. So, if you have pains, get diagnosed or get investigated early. The simplest you can have is either an X-ray or some simple blood test. Like, let's say, suppose you have uric acid, raised uric acid or rheumatoid arthritis, that can attribute to your joint pains. So if you take those medications and not painkillers, you can protect your kidneys, at the same time you can treat the arthritis and also have comfort. Now, when it comes to the X-rays, you should be standing up for the knee X-rays to make sure that we need to see the dynamic, that is when you're loading the knee joint, how the knees are, and also if possible for the ankles also. Now, when it comes to early arthritis, we try to treat by giving you simpler medication like cartilage tablets. This has collagen components, which is one of the components of the cartilage. So you are giving supplement so that it becomes more smoother. First is collagen. Now for ladies post-menopausal, they should take calcium because the bone also need to be stronger. Otherwise the bone can collapse. So calcium and collagen tablets you can take for good number of years. Now, once in a while you might have severe pain or you might not be happy. So, in that scenarios, you can take some painkillers. Those are, when you start off with the ladder, the simplest you can take are paracetamol and tramadol. These are quite safe. The next step will come aceclofenac and diclofenac. And the next step, which are the older ones, I call combiflam. Now, my suggestion is stick to paracetamol or tramadol as long as possible. And also there are some newer medications which act on your nerves. These are called pregabalin and gabapentin. So these also can help alleviate your pains. At the same time, they don't damage your vital organs. And after finishing this regular collagen tablets, you're not getting relief, and probably you're in the next stage of pain and you might need some help from us. That's when we have started doing injections to the knee joint. So knee, for example, for all the joints. So these injections are called PRP and stem cell therapy. PRP is nothing but platelet rich plasma. We take the blood from your body separate out the platelets, concentrate them, and then inject into the particular joint. So what it does, it decreases the inflammation, that is the redness caused by the arthritis. So the pain is decreased. And because it's from your own body, the side effects are least. The next thing is called stem cell therapy. Stem cell is a native cell. So it is like a baby. So it can take different forms. So wherever you put the cell, it takes that shape or form. So for example, if you have the cartilage problem, so we inject the stem cells there, it can become a cartilage. So that can smoothen that area. So thereby avoiding unnecessary surgeries. So these injections can be given to alleviate your pain, and they have been proven recently that they are giving good results. The only thing is you need to come to your doctor at the earliest. Do not delay. If you delay, we can't help you much with these type of latest medication. The next thing is some people will have very delayed arthritis where the legs are really bowed or they can't even walk. Those scenarios, or people who can't afford the surgery at all, or people who want some time to buy before they can plan for surgery. In these scenarios, we do what is called steroid injections. These steroid injections will give some temporary pain relief so that the inflammation is decreased, but this is only temporary because it's going to come back again. The next injections are like you're blocking the nerves. Now, we do these injections in people who can't have surgery because of their health status. Like some people might be having cancer wherein their lifetime is only next 1 or 2 years, or some people are not fit for surgery at all, or some people are too old to have surgery. So these scenarios, what we do is we block the nerves around your knee joint so that you don't get pain impulse from the knee to your brain. So thereby your knee feels better and you walk on that, you do your daily activities like going to the washroom or going to the dining room. I suggest these should be restrained to the areas where the indications as said before. If you are going to plan for the next 30 years for a injection like this, the problem could be the nerves are blunted, so your knee might not act as normal, and even if you have pain, it won't perceive that, and you might end up with fractures or sometimes very bad wear and tear. So these are the different types of latest medication that we are using to treat arthritis. So my suggestion is be clever, act early, then you can avoid joint replacements.